Let me ask you something before we start. When was the last time you actually looked at your tongue? Not brushed it, not rinsed it, actually looked at it in the mirror for more than 2 seconds. Most people never do. And that is exactly why so many older adults miss one of the earliest, cheapest, and most honest warning systems the human body has. Your tongue is not just a muscle that helps you talk and taste your food. It is lined with thousands of tiny blood vessels sitting incredibly close to the surface, which means it reacts fast to changes happening deep inside your body. Long before a blood test gets ordered, long before a scan gets scheduled, your tongue is often already trying to tell you something. And after 60, when circulation slows, when nutrient absorption becomes less efficient, and when the immune system starts working a little differently, that message becomes even more important to catch. Think about how differently we treat other parts of the body. People check their blood pressure at home. They weigh themselves. They know their cholesterol numbers. But almost nobody makes a habit of actually looking at their own tongue, even though it is sitting right there, visible, honest, and completely free to examine. Doctors have relied on the appearance of the tongue as a diagnostic clue for centuries, long before blood tests or imaging existed, because it reflects hydration, nutrition, circulation, and immune function all at once. That has not changed just because modern medicine now has fancier tools. If anything, the tongue remains one of the fastest, simplest early warning systems available to you, and it costs nothing but a few seconds of attention. My name is Dr. Franklin, and if you are new here, this channel exists for one simple reason: to help people over 60 understand their bodies in plain language, without the jargon, without the fear, and without wasting your time. Today we are talking about the tongue, and I want to walk you through 5 specific changes that deserve your attention, not because they always mean something serious, but because ignoring them means you could be missing a signal that is genuinely trying to help you. Stay with me through all 5, because the third one is the one doctors say gets overlooked the most, and the 5th one is connected to a condition that rarely gets discussed until it has already progressed. Before we go further, drop a comment and tell me where you are watching from today. I read every single one, and it genuinely helps me understand who is part of this community. Now here is the concept I want you to hold on to as we go through this list. I call it the mirror test. It takes 15 seconds. Stick your tongue out in front of a well-lit mirror. Look at the color, the texture, the surface, and the edges. Do this once a week, and you will start to notice your own baseline. Once you know your baseline, any change becomes obvious. That is the whole point. You are not trying to diagnose yourself. You are trying to notice early enough to ask the right questions. Sign number 1, a thick white or yellowish coating that does not go away with brushing. Let me tell you about Margaret, a 71-year-old retired schoolteacher from Ohio. Margaret noticed her tongue looked unusually white one morning, almost like a light film had settled over it. She assumed it was from her morning coffee and brushed harder for a few days. It did not clear up. When she finally mentioned it to her dentist, it turned out to be a mild case of oral thrush, an overgrowth of yeast that lives naturally in the mouth, but had multiplied because of a dry mouth side effect from a new blood pressure medication she had started. This is incredibly common in adults over 60, especially those who wear dentures, take multiple medications, or deal with reduced saliva production. Saliva is not just there to help you swallow. It actively controls bacteria and yeast levels in your mouth. When saliva production drops, which naturally happens with age and with certain medications, that balance shifts and a white coating can appear. In most cases, this is treatable with a simple prescription and does not indicate anything dangerous. But here is what matters. If that coating persists for more than 2 weeks despite good oral hygiene, it is worth a conversation with your doctor or dentist, because in rare cases a persistent white patch that cannot be wiped away, called leukoplakia, can be an early precancerous change, particularly in people with a history of smoking or heavy alcohol use. The takeaway here is simple. A coating that clears up in a few days is usually nothing. A coating that stays for weeks deserves a proper look. If you are finding this useful so far, type the number 1 in the comments so I know you are still with me. Sign number 2, a tongue that has become unusually smooth, shiny and deep red, almost like the surface has lost its natural texture. Normally, your tongue has small bumps called papilla covering its surface, giving it a slightly rough texture. When those bumps flatten out and the tongue starts looking glossy and inflamed, doctors call this atrophic glossitis, and it is one of the more reliable physical signs of a nutrient deficiency. Walter, a 68-year-old retired mechanic, came into his doctor's office because his tongue had started burning slightly when he ate anything spicy or acidic, and his wife had mentioned it, looked strangely smooth and red. Blood work revealed a vitamin B12 deficiency, something that becomes significantly more common with age because the stomach produces less of the acid and protein needed to absorb B12 from food, especially in people taking long-term acid reflux medication. Left unaddressed, sign number 3, and this is the one I mentioned that gets overlooked the most, a sore ulcer or rough patch on the tongue that has not healed after 2 to 3 weeks. Most mouth sores are completely harmless. Canker sores, minor irritation from a rough tooth or ill-fitting denture, or a small bite from chewing, these things happen to everyone, and they heal within a week to 10 days without any treatment. The issue is not the sore itself. The issue is a sore that refuses to heal. Richard, a 74-year-old retired postal worker with a long history of smoking, noticed a small rough patch on the side of his tongue that he assumed was from biting it. 3 weeks passed. It did not go away. He mentioned it almost as an afterthought during an unrelated appointment, and his dentist immediately referred him for a biopsy. It turned out to be an early-stage oral cancer, caught early enough that treatment was successful and far less invasive than it would have been had it been found even a few months later. I want to be careful here, because I am not telling you that every slow-healing sore is cancer. The overwhelming majority are not, but oral cancer is one of the few cancers where the mouth itself gives you an early, visible signal, and the 5-year survival rate when it is caught early is dramatically higher than when it is caught late. The rule dentists actually use is straightforward. Any mouth sore, red patch, white patch, or lump that has not resolved within 2 to 3 weeks needs to be examined. No exceptions. No waiting to see if it gets better on its own. If this is information you feel your friends or family over 60 need to hear, go ahead and type the number 3 in the comments. It helps me know this content is reaching the people who need it. Sign number 4, a tongue that feels swollen, seems to be pressing against your teeth, or shows visible scalloped edges along the sides. This one can develop gradually enough that people do not notice it happening in real time, but their dentist or doctor will spot it immediately. A tongue with scalloped wavy edges is often a sign that it is being pushed against the teeth because it has increased in size relative to the mouth. In older adults, this can be connected to an underactive thyroid, a condition called hypothyroidism that becomes considerably more common after 60, particularly in women. An underactive thyroid slows down nearly every system in the body, including causing fluid retention in soft tissue like the tongue. Other signs that often show up alongside it include unexplained weight gain, constant fatigue, feeling cold when others feel comfortable, dry skin, and thinning hair. Dolores, a 66-year-old grandmother of 4, mentioned to her doctor almost casually that her tongue had felt too big for her mouth for months, and that she had assumed it was simply a normal part of getting older. A simple thyroid panel confirmed hypothyroidism, and once she started thyroid replacement medication, not only did her energy come back within weeks, but the swelling in her tongue gradually resolved as well. Now, I do want to mention one important exception here. If your tongue swells suddenly within minutes to hours, especially alongside difficulty breathing, swelling of the lips or throat, or a rash, that is a medical emergency and requires immediate attention, as it could indicate a severe allergic reaction. The gradual swelling I'm describing today is a different, slower pattern, and it is worth raising with your doctor at your next routine visit, rather than an emergency room visit. Sign number 5, and this is the one connected to a condition that rarely gets discussed until it has already progressed. A tongue that feels persistently dry, cracked, or has a burning sensation that is not explained by anything you ate. Saliva does more work than most people realize. It protects your teeth, helps you taste food properly, aids digestion, and keeps the delicate tissue of your tongue and mouth from cracking and becoming irritated. When saliva production drops significantly, a condition called dry mouth or xerostomia develops, and a persistently dry, cracked tongue is often the very first place it becomes visible. In adults over 60, this is frequently caused by one of 3 things: a side effect, from one of the many common medications for blood pressure, allergies or depression, poorly managed blood sugar levels connected to diabetes, or an autoimmune condition called Sjogren's syndrome, which specifically targets the glands responsible for producing moisture in the eyes and mouth. Eleanor, a 70-year-old widow, had been living with a persistently dry, uncomfortable, cracked tongue for nearly a year, assuming it was simply something that happens with age. When she finally brought it up, blood work revealed early Sjogren's syndrome. While there is no outright cure, early management, including specific saliva-stimulating treatments, hydration strategies, and specialized mouth rinses, made an enormous difference in her daily comfort and prevented the dental complications that come from long-term dry mouth, including a much higher risk of cavities and gum disease. If your tongue and mouth have felt persistently dry for more than a few weeks, do not simply chalk it up to getting older. Mention it directly to your doctor and ask specifically whether any of your current medications could be contributing and whether your blood sugar and autoimmune markers should be checked. Before we wrap up, I want to give you something practical, 3 questions you can genuinely use at your very next appointment. Because noticing a change is only half the job. Knowing how to talk about it with your doctor is the other half. Question 1. Is this change something you would expect to see at my age, or is it something outside the normal range? This single question forces a real answer, instead of a reassuring shrug. Question 2. Could any of my current medications be contributing to this? Because so many prescriptions, from blood pressure pills to antihistamines to antidepressants, list dry mouth or altered taste as a side effect, and most patients are never told to watch for it. Question 3. Is this something we should simply monitor, or does it need blood work or a referral now, because the answer to that question alone tells you how seriously it should be taken? Write these 3 questions down, keep them in your phone, and do not be afraid to ask all 3 in the same visit. A good doctor will never make you feel like you are wasting their time by asking specific questions about your own body. I also want to address something honestly, because I know a few of you watching this might be feeling a flicker of worry right now after hearing these 5 signs. That worry is not the goal of this video. Awareness is. The overwhelming majority of tongue changes, the vast majority, are caused by something completely ordinary. A new toothpaste, dehydration on a hot day, a rough night's sleep, a spicy meal, or simply not drinking enough water that morning. The 5 signs we covered today are not meant to make you anxious about every little change you notice. They are meant to help you recognize the difference between something that resolves on its own within a few days and something that lingers long enough to deserve a second look. That distinction, knowing when to simply wait and when to actually ask, is the entire purpose of the mirror test I mentioned earlier. It is not about fear. It is about familiarity with your own body, so that you are the one who notices first, not a specialist 6 months down the road. So here is what I want you to walk away with today. Your tongue is one of the few parts of your body you can examine yourself for free in under a minute, without any special equipment. It will not give you a diagnosis, and it should never replace an actual medical evaluation, but it can absolutely tell you when it is time to ask a more specific question at your next appointment, instead of simply saying, "Everything feels fine." The next time you see your doctor or dentist, and you have noticed any of the 5 changes we talked about today, do not just mention it in passing, ask directly, could this be connected to a nutrient deficiency, a thyroid issue, dry mouth, or something that needs a biopsy to rule out? Specific questions get specific answers, and specific answers are what protect you. I want to leave you with this. Getting older does not mean accepting every new ache, every new change, every new symptom as simply part of the process. Many of the changes we covered today are easily fixable once identified. I have talked to enough people over the years to know that the hardest part is rarely the appointment itself. It is deciding that a small, quiet change is worth mentioning at all. So many people wait, hoping it resolves on its own, not wanting to seem like they are overreacting to something minor. But the patients who tend to do best over the long run are rarely the ones who wait the longest. They are the ones who mention small things early, consistently, and without embarrassment. Your doctor would always rather hear about a change that turns out to be nothing than not hear about one that turns out to matter. That is not being difficult. That is being an informed, engaged patient, and it is exactly the kind of patient who tends to catch problems while they are still small and manageable. If this video helped you see your own health a little differently today, please consider subscribing. I put out videos like this every single week, grounded in real evidence, explained in plain language, made specifically for people who want to stay independent, informed and in control of their own care. And before you go, I would love to know, did any of these 5 signs sound familiar to you or someone you love? Leave a comment and let me know, because your experience might be exactly what helps someone else ask the right question at their next appointment. Take care of yourselves, and I will see you in the next one.